I chose to present my journal review on aquatic versus land therapy for patients with Parkinson's disease. I'd like to briefly mention what Parkinson's disease is. This disease is a neurodegenerative disorder, and it affects the dopamine-producing neurons in a specific area of the brain. The symptoms progress very slowly over the years, and they can vary person to person due to the diversity of the disease. Some common presentations that are noted in these individuals are tremors that usually occur at rest, limb rigidity, and also gait and balance issues. The cause of this disease is unknown, and there is no cure. So as future PTAs, it's our job to help slow the process of Parkinson's disease and work towards helping patients have a better quality of life. The study that I'll be talking about dealt specifically with patients with Parkinson's disease. The focus of the study was to address postural stability and self-movement using a water and land-based therapy program. What I took from the study is that we as future PTAs need to find what works best for our patients and what each patient will best benefit from long-term. At the start of the research, there were 15 individuals with Parkinson's disease that volunteered to be part of the study. There were 12 participants that were initially enrolled. There were 8 men and 4 women. However, 11 ended up completing the program. In order to be eligible for participation, the volunteers must have been in Parkinson's disease stages 2 or 3, while in the absence of the effective medication. They must also lack dementia and be able to follow a stable medication schedule. The study was conducted in a series of events. The first was a baseline assessment. The second was a 4-week intervention program. Following the intervention program was a post-test, and then a follow-up assessment 17 days after the first post-test. There were 5 assessments each participant underwent in order to track their progress. The functional reach test was one of them, and this measured the distance between the participant's initial arm position and the maximal forward reach. There was a Berg balance scale that was used, and this is a 14-item scale used to assess balance using a 0 to 4 scale, 0 being that the participant was unable to do the task, and 4 being that the patient was independent. There was also a unified Parkinson's disease rating scale, and this measured the progression of the disease. Gait was assessed utilizing a 5-meter walkway, and then there was a timed up and go test where the patient started out seated in a chair, got up and walked 5 meters, turned around and came back into a seated position in the chair. After initial evals, the participants were randomly assigned to either a land or water therapy group. The participants met with a PT twice a week for 4 weeks, and each session lasted 45 minutes long. Both land and water therapies followed 4 sections of exercises. These exercises focused on areas of the body such as the trunk, pelvis, lower and upper extremities. The exercises specifically focused on trunk mobility exercises, postural stability, transferring oneself, and changing body positions. The progression criteria were abilities to be achieved through a set of exercises, and if the exercises were achieved, more complex exercises were introduced. So the images on this slide here were taken directly from the article that I used. If you look over to the left, these were the water-based program exercises. The warm-up exercises started out fairly simple, with the PT aiding in getting the individual comfortable with the water environment. Each exercise was done for 5 minutes, and they progressed into more challenging tasks. If you look down at the trunk exercises, at first the individuals began their exercises on their own, just utilizing the pool as their support, and one of the tasks was to move their lower limb side to side. Then the therapist stepped in when the participant was asked to repeat the same motion, but when the therapist stepped in, they did the motion facing and then not facing the PT, and this made things more difficult. If you look down at the postural stability training, the exercises were done with just the patient. In order to progress this exercise, the patient was asked to do the balance control, for example, stepping up onto a step and then having the other foot rest on the ground, and the PT created turbulence in the water, and this added resistance. If you look over to the right side, these were the land-based program exercises. As you can see, the land-based exercises were performed exactly the same, they just weren't in the water. For the trunk mobility exercises, the same exercises were done, but they were used with a medicine ball, and the medicine ball was used to create instability. Same exercises were also done for postural stability as well. These exercises were also performed for 5 minutes, and for progression criteria for each therapy, each exercise must have been repeated successfully 3 times. The results of this study found to be that each therapy significantly improved with functional reach in the same way. After a follow-up analysis was done for each group, the aquatic group seemed to have improved better for the Berg Balance Scale and Unified Parkinson's Disease Rating Scale. According to the data analysis that the researchers used, the improvement for the rest of the tests didn't reach significance. There were definitely limitations in the study that led me to believe that the study wasn't strong. There were not many participants that were involved in the program. There were only 11, and the 4-week intervention just seemed too short to really see long-term gains. The article also didn't give enough detail as to exactly how the participants improved. It just said that they improved, but didn't specifically say how with measurements. It's also important to mention that there haven't been many previous studies aimed at researching aquatic therapy on Parkinson's disease, so this study was mainly used to set up criteria that should be seen in future larger studies. This article states that water can be beneficial for patients with Parkinson's disease. For example, the buoyancy of the water helps to keep patients supported, and it also reduces the chances of falling, especially for the elderly patients. One progression of the water-based exercises was to cause water turbulence, and this adds more resistance than as if the exercises were done on land. Warm water can have a therapeutic effect on rigidity, and some other therapeutic effects include decreasing muscle tone, improving postural stability, improving functional mobility, and decreasing spasm severity and spasticity. So what should we take from all this? Well, as future PTAs, we may one day be working with individuals with Parkinson's disease. I definitely find aquatic therapy really cool, and I would love to work with patients in the pool. When it comes to treating Parkinson's disease, our job is to decrease the severity of the symptoms and make day-to-day activities easier for these patients. If we work in a facility where there is a pool, I don't think we should shy away from the opportunity to use it, because again, we need to focus on what works best for our patients and what works best long term. So this concludes my presentation. If anybody has any questions, feel free to contact me, and thanks for watching.